And speaking of patients, you mentioned a little bit about how dentists, for instance, will be the ones to refer. What is a typical patient journey, and are there any pitfalls that you find that
Yeah.
patients see regularly?
I would say a typical journey for autoimmune disease and then Sjogren's in specific is rheumatologists. Most people find themselves in a rheumatology clinic as their last stop. And they say that all the time. I've been dealing with this for years and years of symptoms. Not uncommon for someone to report over 10 years of symptoms. And I feel like nobody has really given me answers. I feel like there's something wrong. So patients they kind of joke, I've been to every ologist that exists, and you're my last one, and I hope you can give me some clarity. So it's a frustrating path to kind of go through. I think part of that comes from the complexity of the condition. Part of it comes from that these conditions can have very vague symptoms.
Hmm.
And then part of it comes from we probably need more education about rheumatology, autoimmune diseases, and so there can be from another clinician standpoint, like get them into rheumatology sooner than later. We're happy to see them and evaluate them.
Hmm. And is Sjogren's typically the first autoimmune disease that people have, or do they already have them? And, I've heard this phrase like autoimmune disorders beget autoimmune disorders. So
Mm.
is this a conversation that you might have with some of your patients? Like you might want to look out for this, or how does that typically work?
Yeah, so if somebody has one autoimmune disease, they're more likely to have others. They travel in pairs or in groups. That's not uncommon. So whenever I'm evaluating someone for one, I'm actually evaluating them for all within my realm. There's some autoimmune diseases that naturally rheumatologists don't manage, but we're quite familiar with them because they all coexist. So while I may not be the one who manages multiple sclerosis or Crohn's disease, I'm quite familiar because many of my patients have those conditions. So I'm usually when I see them, I'm usually trying to have a low threshold to evaluate for all of the above, and then also equally low threshold to try to fully diagnose all of the above. And we always say autoimmune diseases are what we call evolving. They don't start overnight. People don't often wake up and say, I've got Sjogren's today. They develop very slowly over the course of months to years, and they continue to develop, which is why patients maintain a long-term relationship with their rheumatologist. And I tell them at any point in time, if we feel like, you know what, things are changing, okay, let's look at it again. And I'm happy to do that.
Hmm. How often do you follow established Sjogren's patients, and what are your key monitoring parameters at routine visits?
We see most Sjogren's patients anywhere from, I would say, 3 to 6 months. I'd say the average person who has an autoimmune disease, in particular Sjogren's, sees their rheumatologist about every 3 months. We may space that visit out to 4 to 6 months, depending on disease severity and remission and control. We monitor based on a few things. So I want to see the patient in clinic. I want to be able to evaluate by talking to them, again, examining them. And then lab work, I've mentioned that a few times. I'm going to periodically, every few months, check markers, blood counts, kidney function, liver function, inflammation markers, complement levels. Periodically, I check a blood test that gives me an idea about increased risk of lymphoma and those types of things, a urine. And we do that anywhere between 3 and 6 months, depending on the
Hmm.
person.